Hello, I am Devaki Nambiar. I live and work in India, where cardiovascular disease is a leading cause of death. The Indian government has tried to address risk factors as part of its comprehensive primary healthcare reforms since 2016. The backbone of this effort is the almost million strong cadre of community health workers or frontline health workers called ASHAs. With the support of the Lown Scholars Program in 2018, I carried out a study to understand if frontline workers were screening a sufficient number of community members for hypertension and diabetes as intended by this new program. We specifically wanted to know if there were differences by sex or by poverty status. Our study was carried out in two rural and two urban districts of two North Indian states. We interviewed 2,052 individuals to see if at least half the people in rural areas and a little more, 65%, in urban areas were getting screened for diabetes and hypertension. We found that overall, neither urban nor rural coverage thresholds were being met by frontline health workers. However, this did not mean that across all rural areas, less than 50% were being screened, or across all urban areas, less than 65% were. Quite the opposite. Screening targets were being achieved in some areas. This means that there are opportunities to learn within states and even within catchment areas of a single primary health center. Interestingly, we did not observe differences in screening rates between the rich and the poor, although men, including men at higher risk of hypertension and diabetes, were less likely than women to be screened for hypertension. This was an important finding of our study. When we presented these findings to primary care doctors, they were not surprised, though with this scientific evidence, they and decision makers across levels of the health system are now devising ways to better support frontline health workers and ensure no one is left behind. The COVID pandemic is also teaching us that comorbidities like hypertension are important to diagnose early on to save lives. Having a wide base of outreach for hypertension screening can help frontline health workers better support their communities and make health systems effective and equitable.